The Bureau of Health Education, the Elderly Affairs Unit, and the Taiwan International Cooperation and Development Fund, Taiwan ICDF, have joined forces to launch the Seniors Exercise Program aimed at improving the health and mobility of older adults. The Seniors Exercise Program is a structured initiative tailored to meet the unique needs of older individuals, focusing on gentle yet effective physical activities. As part of the pilot phase, the Ministry of Health has strategically selected several homes for the elderly across Saint Lucia to implement the program. This phased approach allows for careful monitoring, feedback collection, and necessary adjustments before a potential nationwide rollout. Family life educator at the Bureau of Health Education, Naomi Grandison, emphasized the significance of low-impact exercises in promoting overall health.
Today we had a low-impact exercise for the older persons because we recognize some mobility challenges, and sometimes older persons don't move enough, and even if they're on a chair they can actually do a little something. So the elderly unit at the Ministry of Health, the Education and Communications Unit, along with the Taiwan ICDF, we all collaborated in trying to mitigate metabolic diseases such as diabetes, hypertension, and all of the challenges associated with aging by improving physical activity, which is a key factor in helping us with our overall health.
In addition to the physical exercises, educational sessions were incorporated to highlight the importance of movement in maintaining flexibility and cardiovascular health.
We had a short talk to reinforce why exercise is so significant for healthy aging and for also overall health. And subsequent to that, we did demonstrations of the various sitting down exercises, low impact exercises, and we had them to follow us. We had them to follow us while they demonstrated it and they went through it. And thereafter, we did a more upbeat training. So what we have done is that we have trained the staff and we are leaving them with a handbook with the examples of the exercise, a detail of how it can be done. It includes pictures that they can follow so that every day a 10-minute short exercise can be done, which would be suitable for nearly all of the population within the home, because well-being can be maintained well into your 80s once you're able to do your exercise, your strength training, your flexibility, and your cardio.
Assistant Manager at the Cornerstone Humanitarian Society, Elizabeth Stephen, expressed appreciation for the initiative and noted the enthusiasm displayed by the seniors.
The program was very interesting. This is the first time we had this program at Cornerstone. We normally go out, but not in Cornerstone itself. But it was very good. I must say the residents take part in it. I was not expecting them to do so well. But it seemed like they enjoy it, and I myself enjoy it too. My body's hurting me too. The little exercise is good, although I run up and down, but at the same time. And I hope they will come back again to help us out with the residents, because I think in keep coming, they will get more focus and more interested in doing the exercise.
Program Development Officer at the Elderly Affairs Unit, Andrea Alcid, highlighted the selection process for participating homes and the broader vision of the program.
We brought it up to various homes. We were at 9 homes, the 9 homes that we have in Saint Lucia. They all were excited, but we could have only started with 3 homes. We started with two of the one private home and 2 other homes, and they received it very well. They've actually continued the exercises, which we're very happy for. We will be visiting very often to see how it's going, if they need assistance, and hopefully in the very near future, we intend to have the other homes come on board with the exercises.
This initiative aligns with global efforts to prioritize healthy aging and reflects St. Lucia's dedication to improving elderly care services. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika McCoy.